Hi, everybody. This is Erica Mello, and welcome to episode number 60 of Tough to Treat. And do you ever have patients that you see infrequently or you see frequently, and they're coming in and one day they've got back pain, and the next day they have knee pain, or they have left-sided low back pain, and now it's right-sided low back pain. And then the next time it's right hip pain, or the next time it's neck pain. Right? Those patients are tough to treat and frustrating, to be quite honest. And why does that happen? Why is that presentation so frustrating for us and for them? And I've had my share of injuries, as I've mentioned on the podcast, and they're not fun. But when you see somebody who has constantly changing symptoms, is it a motor control problem? Are they just not moving well? Are they not controlling their mobility? Or is it something else? Or a combination of both? And I think when you see patients like this, or any sort of complex, persistent pain type of patient, you need to look at the interregional relationships of the body, how the foot relates to the neck, etc. But you also need to look at them and think about other systems, right? Endocrine system, hormones are a big, big thing. So this episode talks about those interrelationships, not just musculoskeletal, but hormone issues. And this patient happens to be a male. So we hope you enjoy it. And at the end of the episode, we talk about our mastermind that we're having at CSM. And we have a wait list right now. So feel free to email us or contact us, on social media to get on the list. All right. We'd love to see you in Denver in February. All right. Enjoy the episode. Hey, everybody. This is Erica Mello, and with my wonderful co-host, Susan Clinton, and you are listening to podcast episode, I want to say 60.
Yep, number 60.
Of Tough to Treat. Welcome, everybody. How are you, Susan?
Good. How are you today?
I am good. I think we should get right to it because This is an interesting patient, and I want to make sure I include everything. So this is a current patient of mine. I've seen him on and off since, I'm just looking at his chart, since 2010. And even before then, I've known him. And he's had various injuries, ACL insufficiency, hamstring issues, low back pain. I knew him before he got married. He was in sort of improv and acting at the time. And over the years, he has moved into more of a leadership role with organizations. So he went to Columbia Business School. So he went completely the opposite from stage performance to B school and just traveling a lot now. So in the interim, over those many years, so I saw him in 2010, 11, for various issues on and off. He got married and had 2 children. And went 2 beautiful girls. And I actually have treated his wife on occasion as well. He has moved out of New York City into a suburb right now. So I saw him much less frequently. His wife was expecting a baby. She has delivered already, but I'm going to backtrack. Okay. So I saw him. He came back to see me in February of 2019, this past February. And he had moved out of New York City at that time. He loves basketball. Big Boston fan. So plays once a week, didn't have great knees, didn't have any surgery whatsoever, just, rehab. He was complaining of left-sided low back pain and with extended sitting. And so because he had 2 children now, he was also lifting. So lifting bothered him, and he was sitting more in his sort of new leadership organizational days where he would sit and lean more to the left side. And the other movement that bothered him at that time was when he went up for a block in basketball, so kind of resisted thoracic rotation. I'm just sort of putting my hands up. So when he jumped and he blocked a ball, when he sort of went into rotation with a hard hit against the ball, that also bothered him. bear in mind, he has a history of low back issues. He has, he's stress is a big part now with his two children. His wife they're about the same age. He's in his mid 30s, late 30s. And when he came to see me, his wife was pregnant. So he was doing a lot of the work with the children. And no other past medical history really to sneeze about. I mean, nothing really crazy. So I'm just going to sort of jump a bit here because when I first saw him, he was starting to do Pilates. His wife is a Pilates instructor, and he was working out with a new trainer. This new trainer was doing a lot of sort of old school type, I want to say, not CrossFit, but old, Olympic lifting, things like that, squatting, lunging, various and sundry exercises, which is fine. He felt like he needed to exercise. So, any questions so far? Or am I good to keep going?
So, pain on the left side.
Yep.
And is he having pain with anything he's doing with the trainer or the Pilates?
No.
Other than sitting and lifting his kids?
Correct. He also, I'll just mention this now, because since he moved out of the city, I didn't see him as often as I would have liked. He developed some right hip issues, and 3 weeks later, so I'm just going to throw that in there now, okay, which he's had. He would also complain about his back seizing up when he walked. Secondarily, the main issue was extended sitting and basketball and lifting the children. So I just took a look at him in standing, and, once again, I did a bit of a body twist in terms of just a rotational in standing, and he had some issues, sort of rotating to the right side. He had limitations in standing. When I tested him in sitting, just plain trunk rotation, I did some resisted trunk rotation as well, just to sort of simulate the basketball. It didn't bother him in sitting. He was quite limited to the left. I would say left more than right, but limited in thoracic rotation. Sitting and standing body twist to the right, limited to the left, not so much. He also was we call a back gripper. In standing, you could see his left paraspinals, his external obliques. He had this rib flare on the left. He also he kind of stood with a pelvic rotation to the left as well. Some issues in his upper thorax, like a counter twist to the right. Nothing, what you would expect. But what I noticed was the significant gripping in the left external oblique and the left, the iliocostalis, longissimus, in that area. So when I went up and had him, because I like to sort of test what bothers them, within my skill set. So I just put a ball up and I said, just try to resist the ball. Like, just pretend you're blocking the ball like in basketball. And what he did was his entire, so he was a righty. So when he blocked the ball with his right hand, he would shift his whole body to the left, like this. So shift left, rotate right. And he would overuse like that. You could see his obliques and his diaphragm on that left side. So he became more of a chest gripper, as Shirley would say, on that left side. And it reproduced his symptoms. So it's hard to analyze that particular move, but I wanted to see if it flared him up when he did it with me, which it did. So I'm going to fast forward a little bit. Do you have any questions?
I do. What side does he carry his kids on?
He carries them, now in the front, but he carried them on his left side.
That makes sense.
Yep, exactly.
Be shifted and rotated to the right, that makes a nice shelf for you to hang your kids on.
Correct. That's exactly right. So that's exactly right. And everything was right, translated left, which makes sense. So, and because his wife was pregnant at the time, he was doing a lot of the lifting. So what I did the first visit, because I'm going to fast forward because I want to talk about where I am now with him. I did some breath work, into the diaphragm. I just had him try to release his external obliques. I actually tried some taping into his thorax to sort of prevent that translation while he lifted. That actually didn't help, which was surprising. So, because I usually have pretty good success with that, but I think that that's feeding into his whole presentation, which I'll talk about in a second. And we talked about carrying the kids more in the center or even on the right side at some point, but mostly in the center. And I felt that at the time, his sitting and carrying his children in this sort of left translation, right rotation was aggravating his left side, especially with the lifting, because he was gripping his diaphragm and his low back muscles. They was just over recruited basically, and that's what I think.
So with this extended sitting that he's doing at work and everything now, is he a mouse user? Is he a tablet user?
He is a laptop.
Okay.
So he's right-handed, yeah. So he would be using
So he'd be
yeah,
leaning and turning
yes,
with that right side.
correct,
So there was a lot of that going on as well, carrying the kids on the left, and him
correct,
lean over and rotate right and some of that
correct.
other stuff. Okay.
Correct. Now, bear in mind, he had a lot of stress at that time too. He was he's with a new he's in a new business now. So at that point he was transitioning in February of this year. So I wrote in my notes that I felt that the increased translation and inflection position was the main issue. Fast forward like 6 weeks later, because he doesn't live in the city anymore. So I gave him some exercise. I basically went over the exercise progression with his trainer. He basically said, this is what we're doing and what do you think? And most of the exercises were pretty, squatting and lunging, they were all fun. I said, just make sure and have your trainer notice if you're shifting your weight to the left when you squat, when you lunge, when you move. So that's really what I did. His wife put him on the Pilates reformer, and that actually was very helpful for him.
Yeah, because he could feel his body
right.
probably more and feel that he was shifting off or doing things.
Correct. Whereas when you're lifting these heavy weights, you're really focused on lifting the weight versus your form, I think, at least with him. So he came back middle of April, and he started playing more basketball. And meanwhile, wife's still pregnant, and he still had the cutting and the issues with. Now it was the cutting, the cutting maneuvers and the blocking. So I gave him some self-release work to do and some self-diaphragm and some breath work, which he said really helped him.
Mm-hmm.
And sitting was still bothering him. However, this is what I'm coming to. He started to get some right glute pain, and he quotes, pain seems to be shifting around, I put in quotes. So he went from his left low back to his right glute in his right sort of lateral glute area butt. And now bending over was bothering him. Okay? So things were moving with this guy, and this is going to be a theme. Okay, because we all have patients that one day it's this side, the other day it's this side, the next time it's the foot, or this is this guy. And when I saw him in February, forward bending was pretty good. It didn't bother him at all, no problem. And the main issues that really bothered him were, as I said, was the twisting, the thoracic rotation. Now, thoracic rotation was pretty good, and it was mostly forward bending. This time, he had a completely opposite presentation. So I think he may have overdone it. So now he was really more on his right side and rotated to the left. And, these are biomechanical, but the main issue is that his presentation changed. Wasn't the same. And I'm thinking, is that a good thing? Is that a bad thing? I don't know. And I took a look at his hip again, because in the past, he never really mentioned his hip. This was something new. And, he had the typical femoral anterior rotation. Everything else besides the pelvic rotation, which was now to the left, was the same. And his center of mass was to the right. So he completely shifted from one side. I rechecked his body twist in standing. It was still bothersome to the right side. But the seated thoracic rotation was pretty good. At that point, I went in and did a passive accessory vertebral mobility. I didn't do it back in February because I didn't think it was warranted. And he's hypermobile. No surprise. I checked his slump, straight leg raise. It was all negative. He kept telling me when he was walking now, he would have his back would spasm and seize up. Okay, so at this point, this was February, and now we're into April, and he was really focused on this hip now. And I hate to be driven by it hurts here, it hurts here, it hurts here, because you don't want to be chasing the symptoms. So yeah, I wrote down, this is my opinion, and I can tell you what I did. I wrote that this is how I believed at that time. I wrote, given the randomness of his symptoms, because they're quite random now, and the multi-directional nature of his symptoms, I felt that he had a stability issue at that point. I don't know what your thoughts are, but that's what I wrote back in April. So you want to comment on that?
Sure. I was going to say that it sounds like, if we don't want to use the word stability, but it
Correct.
Sounds like definitely he had some motor control issues for sure.
Exactly.
But my question is that I would also have looked down at the feet and looked up at the cervicothoracic area, because where's he stiff?
I'm moving to the foot.
Yeah. Okay.
Yeah. So the cervicothoracic area, he was stiff in his upper thoracic spine, but nothing to sneeze about. His neck. Let me go back and look. Hold on.
But he did have hamstring issues before, once upon a time.
Correct.
Which is also a hallmark of motor control problems.
Correct. I've treated everything but his neck, I think, and his shoulder. I've treated everything on his body except the neck and the shoulders. So I'm going to fast forward because I'm going to get to the foot. So he left on a business trip. So what I did that particular day, I gave him some of the stuff I learned with Shirley, like, getting on all fours, doing some sit backs, just trying to get some control into extension, sit backs. I gave him a hip flexor stretch just because he asked me, and because his psoas was really quite tight. I'm like, well, it's trying to stabilize, it's trying to stabilize your hip. I don't necessarily think, it's a bad thing if you don't stretch, but if you want, you certainly can. And at that particular visit, I did a lot more assessing than treating. So I had him just mostly I sent him home back to his Pilates, and his trainer at that point was on vacation, so he hadn't seen the trainer for a while. And he basically just, I gave him the all fours sit back. So he came back in June. Okay. He had emailed me in May, and he said his back was back to the left side again. Okay. And I was like, this is just, so he wanted to go see a physiatrist here in New York. So I recommended a physiatrist. And so this was about 2.5 months since the last visit.
Mm-hmm.
So he had a brief period of feeling pretty okay. Then the wife got more pregnant and he had to do more of the work around the house. And I do think he has control, but I did go down to the foot in this visit. So he ended up seeing a physiatrist who did an x-ray and an MRI of his lumbar spine, just basic degenerative issues, no major problems. They did an MRI of the right hip, which revealed a labral tear and some cam impingement. He underwent an injection under fluoroscopy for the right hip, got 0 relief for that.
Mm-hmm.
So then I ended up reassessing. So most of the movements, forward bending now was fine. It was, in lumbar, back bending was painful, side bending to the left was painful. So he had the main issue now was walking. So we go from sitting to carrying to walking, from the left side to the right side of the back to the right hip. So I was like, look, and I explained to him, I said, I do think that, the labral, a lot of people do get relief with the injections. You just didn't, because it's probably not what's causing your symptom. So what for me at that point was frustrating, because number one was frustrating because he wasn't coming in enough. And I understand, I understand that. So, and every time he came in, I had to reassess him again because I didn't see him for like 2-3 months. Mm-hmm. So at this point it was walking. So I was like, look, we got to go to your foot, because at this point it's your foot is doing some very funky things with your squatting and walking. So what I do with him, when I can assess somebody in one-legged standing, but I actually had him step forward with his right foot. That was the main issue. Every time he stepped forward with his right foot, he would laterally shift and lose control of the pelvis with a step forward on that right leg. And he would go over on the outside border of his right foot, his femoral head would translate, and he would have symptoms. So I said, what I ended up doing was I had him watch himself in the mirror, and he saw it. The minute he stepped on the right leg, he would translate to the right, mm-hmm. rotate the pelvis, and he would go on the lateral border of his right foot. I ended up correcting his foot, putting it a bit more in neutral, and then no, I'm sorry, I take that back. I ended up quickly taping his foot because he had to pick the foot up off the ground and step. So I just taped his foot into more of a subtalar joint neutral position. I had him step forward with the right leg, zero pain, no translation, nothing. So I'd what you would like your
Yeah,
thoughts on just his whole changing symptoms and that.
yeah. Well, because if the foot has been stiff on the other side, going out on the lateral side, and it sounds like that's kind of where he was driving. So what came first? The foot not being, obviously it was mobile enough to tape it into subtalar neutral, so it's a motor
Yep.
control issue.
Yep.
Is it being driven from the foot or the back? Who cares? At this point, you had to work with the whole kinetic chain.
Mm-hmm. Mm-hmm. Yeah, you're not kidding.
And so, that's where the exercises with the, standing on one leg and the headlights and, keeping your pelvis still and all of that. And where do they begin to work the control from? Because he can't seem to get the control working well for, thinking about it through his trunk.
Mm-hmm.
So just taking it to another area and looking at the kinetic chain from another side. And that seems to have been one of the keys for you anyway, is getting him to think about where his feet are a little bit.
Correct. Correct.
Not just shifting weight, but, just making, one of my cues for people like that is make sure the big toe's on the ground.
Yes, exactly. Me too. Yep.
Mm-hmm.
Yep. I think that because he was so in tune to his, since he was so much on that left side carrying the kids and sitting, that his right foot just really became stiff and couldn't adapt, even if he wanted to shift over onto that right. He did, but he did it at the expense of his hip and pelvis. So, if you want to move over to that right side, you can do it, but if you can't do it via your foot, you're going to do it via the next mobile joint. Mm-hmm. And that's what I basically told him, because I said, you were very aware of being on your left foot and on your left side, and your whole sort of left-sided back issue is resolved, but now you're completely on your other side, and which I don't know why, but he probably just overdid it or overcorrected or did whatever. It's life, okay? So, which I get. It's human. People just want to, I'll go to the right side instead of, staying on my left side. So because his right foot, I believe, was so stiff because he was on his left side for so long, he couldn't adapt, and then the foot just became the driver, whatever the issue at that point. So I would agree with you there. So I'm going to fast forward again because this was back in June. So I ended up giving him reviewing the Pilates exercises. I said, have them do some footwork. I gave him some self-release for the foot, a little ball under the foot, things like that, or a dumbbell underneath the foot, releasing some of the intrinsics. I taped him. We did a video so his wife could tape him. I gave him some easy foot control, toe heel, backwards walking, some seated heel raises, things like that, some calf stretches. So that's what I did. And he also told me that his back sometimes flares up and it gets better with massage. I'm like, fine, go get a massage. It's fine. It's no big deal. You've got, a third child on the way, so that's where I was in June. Okay. He came back in July. So that was quick. He wanted to get a couple of visits in before his wife gave birth. I'm going to condense 3 visits into one because I want to start where I am now with him. So he came back in July. He said overall he felt a lot better with the, with the footwork. Admittedly, not doing as much of it as he wanted to. And he said the main issue now is long walks. So we go from sitting to lifting to bending, now to long walks. And this is like a patient who has had multiple issues. And I think why I wanted to talk about this patient is because ultimately when you have a patient like this, it's a control issue. It's somewhere in the system. And it's not like they need to be mobilized and massaged, and they need some support somewhere. And with this guy, it was really all over the place. So he still was hung up on this cortisone shot. And I was like, look, you didn't get relief. You're not getting relief at this point. It's not happening. Move on. Okay. It's, lesson learned. So what I ended up doing with him here, I rechecked his step forward. He wasn't translating over much at all to the right. It was really more of a forward anterior femoral head. Once again, correcting the foot really relieved his symptoms. he wanted me to look at his hip. He just did, because it was an area of meaning for him. And I feel that if someone still believes it's their hip and you haven't looked at their hip, because I have not, and I did not, I think that you need to do that to sort of disabuse the narrative in their head. It's my hip, it's my hip. And he knows from working with me for so long that, a lot of times it's not the symptomatic area, but he felt that he wanted someone to feel his hip, because the doctor certainly didn't. So I did. And, your typical, tight adductors, tight psoas, hip flexion to 90. He's got cam impingement. This is not a presentation that's unusual for somebody with what's going on in his hip. So I explained to him that, in the Pilates, you wanted, I don't believe you should give people long lever exercises like straight leg raises to people who have labral tears, because I've learned the hard way in the past that tends to flare them up. So what I did again is I worked on the foot, and he really was getting better. So I wanted to progress the foot control before his wife gave birth, and that was sort of the issue. So what I ended up doing with him there is I retaped him. I did some manual release of his foot. I progressed the footwork. We did some forwards lunges, backwards lunges, side lunges, which is really a big, like a lateral lunge is really tough on the foot. So I wanted him to start doing that to see if he could control the movement. So that's what I sent him home with. I'm going to fast forward. He came back one more time before his wife gave birth. Still doing pretty okay. He said he's lifting his kids much more now, and because his wife was just getting bigger and bigger, and he was getting a bit sore in the right groin. So the footwork helped for at least a couple of months. Now he's lifting the kids. They're getting heavier. They're probably 3, 4, 2, 3 at this point. And his wife was due in 2 weeks in mid-July. So I'm going to stop there and get your thoughts.
So my thoughts are, well, groin pain always makes you think about the hip, but it could also be the trunk, because the ilioinguinal and iliohypogastric nerves provide sensory, cutaneous sensory for that area as well. So is it a hip, or is it back to his TL junction again? I'd like to know how he's
hypermobile.
Like. Yeah, and I'd like to know what he looks like with his lifting. Like, how is he lifting with the flat back and straight legs, or is he like hinging at the hips to lift? What is he doing?
He had pretty good lifting mechanics. I think it's when he carried his kids is when he failed. So I had him lift like 5 pounds, 10 pounds, and he looked pretty okay. Early on, way back in February, no, he did not, because he had this big shift to the left. But now in July, when I had him lift, he looked okay. He looked okay. I think it's when he put heavy load, sustained load for like 5 minutes, 10 minutes. That's what got him. So we did work a bit on the lifting, because I couldn't see from like an unloaded position. He looked fairly okay, because he'd been working with the trainer, doing the squats. He'd been doing fairly okay, but it was I'm going to pick you up now because you're crying and I don't care what kind of mechanics I have.
Exactly, because I was going to say, when it comes to lifting kids, most people have great mechanics if they're in the gym or they're in the PT clinic showing you what they're doing. But then watch them with their kids, because they just lean over at their trunk and grab them. They don't go into all of those things. So it could be something that he was doing that way too. And then, of course, like you said, sustained loads for him have always been, compression has never been his friend.
Right. Correct. That's exactly right. So where I am, so I pretty much did the similar, footwork, taping, reviewed his program, and reviewed some mechanics. And I said, look, at the end of the day, if you have to pick your kids up and you have to hold your children, it may sound crazy, but, try and, I gave him a correction for the foot. It's like a drag on the rear foot on the right side. So try doing that to see if it unloads your hip a little bit. Basically, if it's a right foot correction, you're sort of dragging that right rear foot in, almost like you're opening up the medial side of the foot. It's hard to describe on the podcast, but I did that. I said, try that when you're carrying your kids, or at least holding them in a static position. So he did that, and he reported back via email that was helping him in a standing posture. Obviously not going to help in walking, because you're unloading the foot all the time. So so basically, he came in one more time before he delivered. He was doing pretty okay. Uh, he actually started to do some hopping now. It's like, you're hopping now. He started to play with the kids and hop on the weekends, which was bothering his hip a little bit, and his right side of his back. But was having longer pain-free periods with the footwork and being more cognizant of the lifting while holding the children. So his wife delivered. She had a baby boy, so they were thrilled. So I saw him 2 weeks ago, which is where I am now. So he had a baby boy, and he actually said he was feeling pretty good. I was like, "Are you kidding me? You have a baby boy now, and you have 2 other kids, and you're feeling good?" I think a lot of it was that he was very stressed with the impending birth, and just a lot of issues with his new job. He's in a better place career-wise now. He's got his boy. He's got 3 children. That's it. No more kids. He seems better from a mental standpoint, but he still was getting this issue with the right hip and the right side of his lumbar spine, because now his wife had some complications with the birth. She popped a clot, so she couldn't really move for a bit. So he was doing a lot of the heavy work, and what he ended up doing, he had to carry the newborn, and just stand. And he was getting a lot of, I'm not sure how much the baby weighed, to be honest, but he was doing a lot of standing, holding the baby.
Mm-hmm.
Okay. And I went back, and he said that it was standing and lifting and walking. And I just watched him walk again. The whole right translation of the hip came back. It's the same old. Okay. And I reviewed the footwork with him, and he's much more cognizant of his lifting mechanics. But at this point, I'm sick. I mean, not sick. It's frustrating for me because it's always with the lifting and certain loaded positions that he gets this now. And I'm not worried about step forward and bending forward. All that was fairly good. It was really the loaded positions. Working with a trainer, no more. That person moved. He hasn't worked with a trainer in like 2 months. He wants to get back to Pilates. So that's where I am. And I'm like, it's one thing. It's always changing. But the main thing that the consistent aggravating factor was lifting. So we got everything else better, sitting, walking with the foot, but now I'm left with the lifting. And I wanted to talk about him because he's the kind of guy that's going to, I've treated him for many injuries, and he's going to have one thing after another. And I wanted to bring him up because I do think he has a major control issue, and that's where I am now. So I want your thoughts on, in terms of giving him a sound, because I know I have a good idea of what I want to do, but I need another opinion, because I'm kind of sick of like all over the place with this guy, to be honest. It's like driving me crazy. So you have the floor, my dear.
Is he tall?
Yes. Basketball.
Does he have big hands?
Yeah. Yes.
Is he close to like the Erlov's Danlov or Marfan's or anything like that?
Good question. I don't think so. But
I'm just wondering if he's how old is he?
Late 30s, maybe early 40s at the most.
He probably should have an autoimmunity test done.
Yeah.
And he should probably have a HVLA done, and he needs to have a thyroid panel done.
Yeah.
Because this has been that there's multiple kinds of stuff going on. There's probably something else happening. Question the surface that's driving his sensitivities.
You said autoimmune, thyroid, and what was the third one?
Thyroid.
So thyroid, autoimmune, HDL. What's HDLA?
No, HVLA.
Oh, got it. What's that?
That's the one that they look at inflammatory markers.
Oh, not heard of that one. Okay.
He needs to have some of that looked at.
Yeah.
I don't know what his diet is like.
Pretty good, actually. I asked him that.
But
yeah.
he might try eliminating inflammatory foods.
Yeah, we talked about that.
And see, and particularly dairy, and see how he does. He probably should have with a family and everything else too.
Yeah, his kids eat pretty well.
Yeah, but I'm just, again, there may be some autoimmunities in there, and they need to know about them.
Mm-hmm.
You know,
Yep.
so, but I would get off the dairy for sure and see how that does. He's just got some
All over
inflammatory
the place.
going on, and even if they eat healthy and they're good, the foods that they eat can still be inflammatory to them.
Yes.
So,
True.
you
True.
know, so you could kind of hook them up a bit with some anti-inflammatory diet stuff,
Mm-hmm.
and some things like that, because especially if he's been under a lot of stress, his
Mm.
response to stress may not be so bueno, and so
Mm-mm.
that's gonna affect your GI system and its ability
Yep.
to function as well, and can keep inflammatory issues going.
Yep.
And so, because when things are bouncing around the world like that all the time, there's some issues, um,
Yeah. Yeah. Yeah.
in the system itself, and those are some good places to start.
Yep.
He can do that with the regular doctor, but he probably should make his way over to a functional medicine doctor and
Mm-hmm.
really have some other deeper allergy and or antibody testing done, just to
Yep.
see if there's anything else.
Mm-hmm. Mm-hmm.
Because he's just, if he doesn't have one of those connective tissue kinds of things, he's close. Just
Yes.
because of everything that's been going on. So this is
Correct.
very typical of something that we see with females
Yep.
that are in the same boat, and generally they have some sort of inflammatory markers going on as well. And it's just so much more than just loading them. And you really have to look at what they need to do, and does their diet really need to be changed? And because what's good for their friend may not be good for them.
Correct. Correct.
You know,
Exactly. And I think the hormones, we were talking before we got on about hormones and although this guy is not, postmenopausal, I mean, I think hormones and thyroid and I think all that is very important
hmm
in when you have this persistent type of issue like this guy has had, even in
yeah.
men,
Well, and he fits the profile.
Totally.
I mean, he does. He just, if he was female, it would probably even be a little bit more widespread pain. But it
Correct.
isn't, so, and, chasing these things, he's got these sensitizations everywhere. And it may not be that there's a tissue issue, but there's a sensitivity issue around these areas where there may or may not have been a problem before. And now
Correct.
that hip is sensitized, and, it's been going on a long damn time.
Yep.
And he can get it to feel better, which is good. But there's some, the missing piece there is what's helping this flip all over the place.
Exactly, and I think that's the
So in
Go ahead.
response to everything else, it's great that he wants to get back to Pilates. I would encourage him to,
Yeah.
you know, be sure that he's like backing off a bit and allowing his core to really kind of come on and not let the big giant muscles be the ruler of the day,
Mm-hmm.
but to get the
Yep.
deeper muscles in with the breath and stuff that they do in Pilates, which would be great. Or yoga even would be really good for him,
Yep.
just because he could learn to stand and load in
Mm-hmm.
those postures and poses,
Yep.
and add the breath in and learn some. And he loved the breath work that you did with him earlier, and so he could learn some different breath types, which can be very helpful for him, in a situation like that.
Yep.
That I would, and it would work through, both will work through the feet and through everything, which is also very good.
Yep. Yep.
And then if he's interested, if you could, if he doesn't want to come and see you all the way, trying to get him to somebody who could do not Olympic weightlifting right away, but maybe start him off a little bit lower.
Yeah.
Doing sit-ups with the medicine ball and, doing, some core activation work and monster walking and, some different things to vary up his exercise program a little bit.
Yep.
But, and to, I don't know, to kind of help him along that way a little bit, to just kind of give him a little bit more oomph to his system.
Yep.
It's hard when you have kids and you're working, a pretty big job,
Yep.
to find the time to do everything. And so they tend up being kind of like all in and then all out,
Right.
for the periods of time. But
Yep.
if he could get into some of that, and the reason I bring up the yoga is, maybe it's something that could also help him with his response to stress.
Yes,
If
absolutely.
he had that, 2 or 3 times a week, just that time to really be kind of collected and quiet, and pull everything together,
Yep.
to help him kind of like, okay, so, rather than going Mach 5 with his hair on fire all the time,
Right.
doing that with exercise too, trying to find that balance in there.
Yep.
He does have some heavy duty stuff, but he has some of the other stuff too, the quieter,
Yep.
that's still exercise. It would be really good for him to help him
Yeah.
pull that together. If neither one of those appeal to him, then maybe even a Tai Chi class.
Yeah. Yeah.
Because
Yeah. He
again,
would love
looking for that mind-body connection, just that, really working the joints and
Yeah.
the movement and the stuff, that it would help him tolerate, or maybe figure out, or maybe not be so worried about loading so much, or because of the way that
Yeah.
that particular form of exercise can really help with all of that as well. Those big joints and
Yeah.
balance and posture, and really having to work your feet and do twisting and turning, and all of
Like
that.
basketball.
Wonderful.
Yeah.
Yeah,
Yeah.
that would, I was just thinking, well, that would be standing, so that might feed into some basketball
Yeah.
stuff for him.
Yeah.
So there's a number of choices he has,
Yeah.
but he needs to find something that he can do a bit more consistently
Consistently.
wherever
Yeah.
he can do it. Yeah.
Yeah. I think the Pilates he can because his wife has a reformer in the house,
Mhm.
and the yoga he certainly can. I think with him, he was doing some of the lifting, way back. I think when he was somewhat symptomatic, when he was really more on his left side, and I think getting him more aware of that really helped him get through the summer.
Mhm.
But what the reason, as I mentioned, why I wanted to talk about him is because we all have patients where it's like one thing after another, and it's
Right.
definitely a hypermobile presentation. I agree with you on the autoimmune. I think that this is not, you don't want to keep chasing symptoms at all, but when you look at the overall picture with him, and you have to look at the whole person here, because it's not, his wife, his kids, his lifestyle, it all plays into it. And I think we would save ourselves a lot of time and frustration if we really looked at this whole presentation. And I think, for him, yes, he wants to start lifting, and he will. And I think he absolutely can start loading, and he does
Yeah,
every day with his
definitely.
kids, for God's sake. So it's not like he's not doing it already. But I actually just texted him a couple days ago, because I saw him a couple weeks ago. So I will discuss a lot of the blood tests with him, and I think he's the kind of guy who would be totally up for that. So this is fabulous. Cool. I mean, I think that sometimes we get frustrated with patients like this, but and we say, well, it's patient's fault, or it's blah blah blah. Well, no, it's not. I mean, this is who we are, and
Mhm.
I've mentioned many times on the podcast, I've had multiple injuries, so I probably fit into this profile. So it's one thing after another. So it's not just the loading. It's your autoimmune. If you have your thyroid, it's your
Mhm.
doing the right things for the right reasons, I think,
Like I
ultimately.
say,
So
if it's none of those things, then maybe some further testing, or just do an elimination diet and see how he
totally.
feels. Just get off the
Exactly.
stuff, and
Exactly.
and maybe work with a nutritionist, and
Hmm.
do what he can do to kind of get him away from inflammatory foods, because a lot of people don't realize that sometimes the food they're eating for them may be inflammatory. It may not
Right.
be for you, but it might be
Oh,
for me, so
totally.
right.
Yeah. Yeah, absolutely. Yeah, I've done that. So
Mhm.
that's that.
All
Cool.
right.
Well, thanks everybody. Hope you enjoyed it.
Yep. And did you want to say anything about
Oh,
the
yes.
mastermind?
Yeah, so CSM this year in Denver, February 12th to 15th. No, 13th to 15th, right? Yeah. We are having a mastermind on the 12th, which is the Wednesday right before. We're formalizing, oh gosh, the details, and it'll probably be a full day, I would imagine. And, we're going to get together a group of people, and we'll, talk all things clinical, and bring us your toughest patients. We have to figure out the details, but please email myself at erica@ericamello.com, or Susan at embody-pt.com if you are interested, or if you're on our podcast list, just email back, reply back to that email. Our website, www.toughtotreat.com. If you opt in there, you'll get a Clinical Pearls PDF that I wrote, and it's some great issues on sleeping and persistent pain that Susan wrote, and you'll get our emails every couple of weeks. So look forward to seeing everybody in Denver, and if you have any questions, just reach out. Bye.